Have you been advised surgery for gallstones and ever been wondering what to do, whether to undergo surgery or avoid surgery or take alternative medicines for gallstones? Then this is the video for you to watch. Before going on to the treatment for gallstones, you need to understand why gallstones are formed. Gallstones are formed because the bile which is stored in gallbladder becomes supersaturated with bile pigments and cholesterol. It also means that the gallbladder is not functioning properly, which leads to sedimentation and the stones are formed. Gallbladder stones are not like kidney stones. The cause for gallstones and kidney stones are totally different. So, gallstones treatment, the gallbladder has to be removed unlike renal stones. It is similar to an appendicectomy where the appendix becomes dysfunctional, you remove the appendix. It doesn't make a big impact on your health and it doesn't affect the digestion problems whatsoever. Now, gallstones, if they slip down and they get obstructed in the neck of the gallbladder, they would cause severe pain, which is also known as biliary colic. Typically the pain is in the right upper abdomen, which goes to the back, lasting for 4 to 6 hours, which requires some strong analgesics for it to subside. In some cases, it may progress and form pus in the gallbladder, which is known as empyema, in a condition known as acute cholecystitis, which is an acute attack of the gallbladder. It may also lead to perforation of the gallbladder, in which case it can be an emergency situation which requires immediate surgery as well. Coming to the surgery of gallbladder, the surgery is a simple surgery which is known as laparoscopic cholecystectomy, which is done with small punctures over the abdomen. 3 to 4 small 10 mm to 0.5 centimeter incisions are made and the gallbladder is removed. The surgery typically lasts for about 1 hour and the patient goes home next day. This is the standard treatment of gallbladder stones worldwide. As I mentioned earlier, if not treated in time, these stones can cause complications in the form of acute cholecystitis, empyema or perforation. In the picture you can see, if the stone slips further down, it can get obstructed in the common bile duct or the bile duct which carries the bile from the liver and the gallbladder to the small intestines, which can produce a condition known as obstructive jaundice. It may also get obstructed at the common channel between the common bile duct and the pancreatic duct, causing obstructive jaundice as well as pancreatitis. Both obstructive jaundice and pancreatitis itself are situations which are difficult to treat and may cause life-threatening conditions. So, when this happens, an obstructive jaundice or pancreatitis due to an gallstone which is obstructed in the common system, instead of one single surgery, it requires 3 procedures, in which the first stage, ERCP, endoscopic retrograde cholangiopancreatography is done. The stone is removed, a plastic stent is placed. In the second stage, the gallbladder is operated with laparoscopic cholecystectomy, and in the third stage, again the stent is removed. So, a simple thing which could be managed with a laparoscopic cholecystectomy gets converted into 3 procedures if the stone slips down. What are the common mistakes people do when they are diagnosed with gallstones? People tend to take medicines for prolonged period with the hope that these stones would dissolve, which fails, and they invariably come with pain or complications for surgery. This is the first most common mistake that people do. The second most common mistake people do is, along with taking medicines for gallstones with the hope that it will be dissolved, they tend to do serial ultrasounds every 3 monthly or 6 monthly to see the size of stones. So let me tell you with an example. Let's assume this is a gallstone. If the ultrasound probe, sonography is done with ultrasound probes. So if the probe is held vertically like this, it may seem that the stone is about 3 to 4 centimeters, just as example. But let's say the stone is lying horizontally in the gallbladder and the probe is held obliquely. Now the same stone may seem like 1 or 2 centimeters. So the size of the stone changes as per the orientation of the ultrasonic probe and also the position of the stone in the gallbladder. So again, this is a mistake that people do, doing serial ultrasounds and seeing whether stone size is increasing or decreasing. It carries no meaning. The third mistake that people tend to do is they assume that since there are multiple small stones or a single stone, they won't have any problems. So let me tell you, number of stones do not matter, because a small single stone can also give problems, a large single stone also can give problems. Multiple small stones can slip down and cause the problems that I mentioned earlier. So based on the number of stones, it doesn't make any difference what the treatment outcome, or number of stones should not decide the treatment. So the question, when should gallstones be treated, which is the topic of this video. The earliest symptom of gallstones is dyspepsia. Dyspepsia is indigestion to fatty food. So if you are taking fatty food or your regular quantity of food and that is causing a sensation of bloating or a sensation that air has been filled up in abdomen, or there is discomfort in the upper abdomen after having food, this is dyspepsia. This is the first sign of a gallstone, and that is the time when one should undergo an elective and planned surgery, which is a simple straightforward treatment procedure. If not done at this stage, the first attack or pain in right upper abdomen, which I termed earlier as biliary colic, is the opportunity to get it treated. One should not be sitting on this problem thinking that it would get resolved, which may land up with severe complications later on. One needs to consult a surgeon who is doing laparoscopic cholecystectomy routinely and regularly to understand the timing of surgery, is what I can tell you. So to summarize, friends, gallstones, if they cause dyspepsia or pain, should be treated in time to avoid complications, and a simple surgery like laparoscopic cholecystectomy can help one to solve these problems. There are no medicines which can effectively treat gallstones, and waiting only prolongs the treatment and it's not healthy for the patient. If you like this video, please subscribe to our channel, like and share. Thank you.